coming up here, right where this little silver hook is. All right, and then this is going to be the aortic arch right there. All right, and then right here we have our superior vena cava, and then coming up right here we have our inferior vena cava. Right, and then this is also the inferior vena cava, but there's a point right here where it's been completely cut away. So now what I'm going to do is I'm going to take away the heart, get a clearer view here of the aorta. And so here is our ascending aorta right here. Here's the aortic arch, and you can't see where the aortic arch becomes the descending aorta, but here is the rest of the descending aorta. Here, and then right here is where the descending aorta is going to travel through the diaphragm rather. And then you can see the remainder of the descending aorta down here as the abdominal aorta, inferior to the diaphragm. And so remember, where we started off before with the PowerPoint, the three branches coming off of the aortic arch are the brachiocephalic trunk. So this is the brachiocephalic trunk right here. And then here we have the left common carotid artery, and then you can see the remainder of the left common carotid artery coming up through here. And then there's going to be let's see if I can get the lung out of the way so we can show it. Then there's going to be a left subclavian artery as well. So I'm going to take the rest of this left lung out of the way. And then you can see it right here, this third artery coming off the aortic arch is going to be the left subclavian artery right here. So again, the three arteries coming off the aortic arch are going to be the brachiocephalic trunk, the left common carotid artery, and your left subclavian artery. And now, what you can't see very well here is the branch point of the brachiocephalic trunk. So right about here is where the brachiocephalic trunk is going to branch into the right common carotid artery, which you can see just a little bit of, and then you can't see the right subclavian artery at all. Maybe if you look way up here, you can see just a little sliver of the right subclavian artery traveling. But certainly we would never, put a sticker labeling the right subclavian artery on this model on a graphical, right, where it's barely visible. So now I think we want to turn our attentions downstairs on this model. I don't think we can see anything more as far as the head and neck. So again, here is the remainder of the descending aorta after it's traveled through the diaphragm. This is also the abdominal aorta. And so right up here at the very top of the abdominal aorta, we can see one of those inferior phrenic arteries. This is the right inferior phrenic artery. The model maker should have made a left inferior phrenic artery as well, but they didn't. All right, and this inferior phrenic artery is labeled 361 by the way. Then right here is where our celiac trunk is, and the celiac trunk is almost non-existent. All right, it immediately branches into its three branches. So the superior branch is your left gastric artery, which is going to be taking blood to the stomach. Gastric means stomach, right? Over here to the left, this is the beginning of the splenic artery, which is going to be taking blood to the spleen, all right, which isn't even shown here. The spleen is going to be over here. And then over here on your right, this is going to be the common hepatic artery, which is going to be taking blood to the liver. The liver has been taken out. The liver would be over here in the upper right quadrant of the cavity. And then right here you have your superior mesenteric artery, singular artery coming right off the front here. And a great landmark for your superior mesenteric artery is going to be your left renal vein. See how the superior mesenteric artery just kind of flops right over that left renal vein. And then we keep on going and we see our two gonadal arteries shown by these red pipe cleaners going to the gonads, right? So the right and left gonadal arteries are going to be going to the right and left testes in the male, and the right and left gonadal arteries are going to be going to the right and left ovaries in the female. And then right here, this is your inferior mesenteric artery. Okay. And here we reach the very bottom of the abdominal aorta where it branches into the right common iliac artery and the left common iliac artery. And then right here we have the further branch points, which we didn't talk about, we'll talk about next week, of this is where the common iliac arteries in both the right and the left are going to split into their internal and external counterparts. So here, starting with the right, this is where the right common iliac artery is going to turn into the right internal iliac artery and the right external iliac artery. And then over here on the left, this is where our left common iliac artery is going to turn into our left internal iliac artery and our left external iliac artery. The external iliac arteries are going to be going on to the lower extremities, and the internal iliac arteries are going to be feeding blood to the pelvis, as you can see by their directions. All right, so now let's go back to veins. So as far as veins go, in the head and the neck, we can see just on the left side your left internal jugular vein, all right, and then just a little nub of the left external jugular vein. But you can't see the right jugular veins at all. And so right here, you can see just a little bit of your left subclavian vein, and then the rest of the left subclavian vein over here as it travels underneath the clavicle. And right where the internal and external jugular veins come together with this left subclavian vein is where we're going to form the left brachiocephalic vein. So this is the left brachiocephalic vein. And then over here on the right, you can see at least the right subclavian vein, but you can't see where it comes together with the internal and external jugular veins on the right to form the right brachiocephalic vein. Right, but that's what's going on over here on the right as well. So what's going to happen is our right and left brachiocephalic veins are going to be coming together to form the superior vena cava, which is 312 right here, which then delivers the blood to the right atrium. Down here in the abdominal pelvic cavity, we can see the inferior vena cava. All right, so it's going to continue on to deliver blood to the right atrium as well from the bottom as it passes through the diaphragm. Right here, you can see your left and right renal veins. Because the inferior vena cava is shifted over to the right, this left renal vein is going to be a lot longer than the right renal vein. As a result, the one suprarenal vein that's shown, which is the left suprarenal vein, that is the left adrenal vein, draining blood from the adrenal gland, is going to be taking a shortcut directly to your left renal vein. Whereas if the artist had shown the right suprarenal vein, it would be taking a path directly to the inferior vena cava. And then a little bit further down, we see our gonadal vein. So this is the right gonadal vein, which has kind of a teal or aqua-like color to it. Sometimes people think it may be a lymphatic vessel, so just so you know, it's just a different color because it's faded. It was made out of a different material. And then here we have the left renal vein, which looks like it's actually been damaged a little bit since the last time I've seen this model. I think it used to come all the way down here. But in any event, the right gonadal vein is going to drain blood from the right testis or ovary and take it directly back to the inferior vena cava, whereas the left gonadal vein draining blood from the left ovary or testis is going to take a shortcut, just like the left suprarenal vein, and connect back to our left renal vein. And then the blood from the left renal vein will go back to the inferior vena cava. And then all the way down here at the bottom, you can see where the two common iliac veins are coming together to form the inferior vena cava. So right here, you have your right common iliac vein, and then right here you have your left common iliac vein. Here on the left, you can see also very clearly where the left external iliac vein converges with the left internal iliac vein to form that left common iliac vein. On the right, I think it's a little bit harder to see because that right internal iliac artery is right in the way. But what's being shown here also, to some extent, on the right, is you can see your right external iliac vein converging with your right internal iliac vein right about here to form your right common iliac vein. And then the right and left common iliac veins converge together to form